So we're going to talk about histamine receptor blockers. Now there are two main categories in these medications: histamine 1 receptors blocker and histamine 2 receptors blocker. In this video we're going to take a look at about the histamine 1 receptor blockers and what are the mechanisms of action, side effects, indication, and what are the names of the medication. And we'll take a look at this histamine 2 receptors blockers in a different video. Okay, so let's take a look at the first of all the mechanism of action of this medication. So we have a histamine, which is inflammatory mediator in our body. What it means, like whenever any kind of allergen enters our body, there is an inflammatory reaction happens, and the main mediator is basophil and mast cells. They releases this histamine in our body, in our blood, and this histamine goes and binds to the histamine 1 receptors. When it binds to histamine 1 receptor, it causes all these kinds of reaction. All kinds of signs and symptoms right here, like itching, increased mucus secretion. That's why you'll have a runny nose, nasal congestion, flushing, headache, tachycardia, bronchoconstriction, increase in vascular permeability. That's why they will have edema and all kinds of stuff right here, and it will cause the hypotension. So those are basically normal inflammatory signs and symptoms you'll see if you have an allergy to pollens, and if you get into contact with the pollen, then your body reacts this way. Now what this medication does, it actually blocks the histamine 1 receptors. So right here, it blocks this histamine 1 receptor. So when it blocks the histamine 1 receptor, the histamine won't be able to bind to those receptors and produce any of this effect. So that's the basic mechanism of action, is to bind to histamine 1 receptors and block them, so the histamine cannot produce these effects, which is itching, nasal congestion, headache, tachycardia, bronchoconstriction, hypotension, and edema. So now we learn this is basically when it happens, like when you are getting contact with the allergen, this kind of reaction happens. Now this medication uses for allergic rhinitis, obviously, urticaria, pruritus. These medications also used in anaphylactic reaction, but however, you have to be really careful in this in this statement, in conjunction with epinephrine. So you can give a patient these medications in order to relieve those symptoms. However, you have to give epinephrine at the same time if they are going in anaphylactic reaction. Now the main difference between, like people always get confused, okay, so what's the main difference between allergic reaction and anaphylactic reaction? So you have allergic and anaphylactic reaction. In allergic reaction, there won't be any involvement of respiratory. Like it can cause the bronchoconstriction, but not at the extent that will prevent patient breathing. While in anaphylactic reaction, they will have a swelling around their airway, and that will make them hard to breathe. So basically that's the main difference. In anaphylactic reaction, patient won't be able to breathe normally, like they'll be having a really hard time. While the allergic reaction, they may have a bronchoconstriction, however they'll be breathing normally. Not normally, but they'll be breathing while not in the anaphylactic. That's why you need to give epinephrine in order to reverse that swelling around the airway and to do the bronchial vasodilation in anaphylactic reaction. But we can give this medication in conjunction with epinephrine as well. Now, when you have a like allergic reaction, it causes the sneezing, runny nose, itching of the eyes. So this medication is also helpful to prevent those signs and symptoms as well in allergic reaction. And this medication actually causes sometimes significant sedation. So this is kind of off-label use. People uses this medication for sedation. Like the main widely over-the-counter medication used for sedation from this category is Benadryl. All right, now in this video we're going to talk about what are the examples of this medication before we go into the side effects, because I'll tell you why we did this one. So this is the first generation medication, histamine 1, 2nd, and 3rd. These are kind of really hard to remember the names. There is no no easy way to remember them except repeating them every day in order to remember them better. So some of the main ones are diphenhydramine, chlorpheniramine, promethazine, dimenhydrinate. Those are the widely used ones. In second generation, cetirizine, loratadine. In the third one is fexofenadine. Those are the main widely used medication in the United States. Now, basically the first generation medication are older drugs in this categories, while the second one are a little bit newer, and the third one are newer than second generation. And third generation has actually less side effects than the first generation and second generation has less side effects than first generation, like that. So that's why I just wanted to point it out before we go into the side effects. Like, one of the main side effects of this categories is sedation. Third generation actually doesn't cause that much sedation, that at extent that will impair your ability to work, while the first generation can cause really significant sedation. They'll make you drowsy, you can't really focus. That's why when the patient takes this medication over the counter, you want to really educate them, like, do not drive right after you take this medication. Allow at least 8 hours sleep after you take this medication, because you can't really take this medication and just have like 4 hours sleep and then go to work or do some kind of cognitive activities, because it's going to impair your ability to do those activities significantly. Let's take a look at the side effects. First of all, the dry mouth, headache, dizziness. It can cause the urinary retention, cause nausea, vomiting, obviously the sedation, and hypotension. And this is the one, sedation, as we talked in the previous slide. The first generation histamine 1 receptor blockers will cause the significant sedation compared to the third generation. Now this one, there's other side effects in a separate box here. These are the like really very lethal side effects, like paradoxical excitation. So if someone suddenly stops this medication, they can have a paradoxical excitation. Like, since this medication causes sedation, it will cause insomnia, restless, anxiety, and so forth. Like, it can cause really bad paradoxical excitation. It can cause the hypersensitivity reaction. Now, this medication can also cause the extrapyramidal symptoms. And what are those? Dystonia, akathisia, Parkinson, and tardive dyskinesia. So those are the extrapyramidal symptoms, and we'll go in these symptoms in detail in antipsychotic medications. But those are the really bad side effects this medication can have. Also, this medication can cause the agranulocytosis and can significantly decrease your WBCs, decrease in WBCs, and can impair your immune system as well. And this medication, since it causes the sedation, it definitely can cause the respiratory depression as well. So you have to be really careful and need to do a really good education if one of your patients taking this over-the-counter medication at home, to be careful about these side effects. I think that was it about the histamine 1 receptor blockers. Thanks for watching. If you have any questions, let us know. Thank you.